Good afternoon and welcome to the third floor of Waco City Hall for our weekly press conference that we have to inform you about information that is vital to this community about the COVID-19. I'm Larry Holze, Director of Municipal Information and Communication for the City of Waco. Joining me in our conference room here, still all wearing masks even though we're more than 6 feet apart, is Esmeralda Hudson, our City Secretary, Kelly Crane with the McLennan County Public Health District, Mark Randolph in our Television Department, and myself here in this room. And joining me by television on our Zoom call today, our Mayor Kyle Deaver, Dr. Brian Becker from the Ascension Providence, and Dr. Jackson Griggs from Family Health Center. But we're also downstairs in our studio recording this a whole voice track translation in Spanish. And we're also doing American Sign Language translation because we want all parts of our community to get this information and know everything, and so we don't have to go through other persons too. So we want you to share this with anybody that you feel like needs to have that. And always so gracious to be here to invite our Spanish-speaking audience to listen today at 4:30 when we will have taken the audio track that we're recording and laying it over the video and a full translation at 4:30 this afternoon is our City Council member for District 2, Hector Sabito. Hector, thank you for being here. Would you do your invitation for us?
Larry, as always, thank you so much for the invitation. Para ayudar a nuestros ciudadanos que hablan español a saber lo que se dice durante esta conferencia de prensa, un traductor está grabando una traducción en español en vivo durante la conferencia de prensa. Esta grabación completa en español reemplazará el sonido del inglés en el video y una versión en español de toda la conferencia de prensa se reproducirá en el canal de cable de la ciudad de Waco aproximadamente a las 4:30 de esta tarde. Puede ver la conferencia de prensa en el canal 10 o por internet en vivo en wccc.tv. As always, Larry, it's an honor to be here.
Thank you so much for being here too, Hector. It's always great. Joining me again, like I indicated, we have our Mayor Kyle Deaver. We do have Dr. Jackson Griggs, who's the CEO of Family Health Center, and Dr. Brian Becker, Chief Medical Officer for Ascension Providence. I'm going to ask each of you to make an opening comment like we've always done before, and we'll start in that order. We'll go with Dr. Griggs first, followed by Dr. Becker, and then let Mayor Deaver finish up from there. So, Dr. Griggs, it's yours.
Wonderful. Thank you, Larry, and thank you again, Mayor, for the invitation back. I'll start with worldwide cases. There have been 47 million cases of the novel coronavirus worldwide, with 1.2 million deaths from COVID-19. The World Health Organization has reported record high new case counts for this sixth consecutive week globally. The United States continues to lead the world in new cases. We're now averaging over 80,000 new cases per day, and we have surpassed the threshold of 100,000 new cases in a single day for the first time, and that was on October 31st. In terms of new deaths per day, the United States again crossed the threshold of over 1,000 deaths per day at the end of October. To date, the United States has seen a cumulative total of 9.4 million novel coronavirus cases and over 232,000 deaths from COVID-19. In terms of state numbers, Texas has seen over 900,000 cases and 18,194 fatalities to date. Let me now share McLennan County updates as of this afternoon. Our total number of confirmed cases is 10,674, 661 of which are currently active. And as of this afternoon, the Public Health District has received notification of 145 new cases of coronavirus. 60 people are currently hospitalized with COVID-19. 15 of those 60 are requiring ventilator support at the current time. There have been 2 additional deaths in our community due to COVID-19, bringing the sum to 160 fatalities to date. There have been over 100,000 total tests performed, and over 80,000 of those have been performed on McLennan County residents. Within elder care facilities in McLennan County, Currently, there are 13 facility outbreaks defined as one or more resident, and there are 19 active cases in these facilities. There have been a total of 67 elder care facility related fatalities. The county jail, there's currently one active case. There are no current church clusters that have been identified within McLennan County. There are 12 independent school districts and one private school that are reporting cases on campus. And within schools, the health district is aware of 65 active cases, including 48 students and 17 staff. Let me now share some slides that plot our community's incidents and some, as I've done before, some thresholds that are described by Harvard's Global Health Institute. So here you see the United States trend of new cases per day per 100,000. This is on a 7-day rolling average. And you see this peak that we've discussed many, many times now in July. And what you see now is a climbing incidence that exceeds the average number of new cases per day that was experienced in July. The current number in the United States is 24 new cases per day per 100,000. If we look at Texas, what we see is a climb that parallels the climb in United States cases. And the state is currently at 22 new cases per day per 100,000 on 7-day rolling average. And here you see McLennan County. While not quite the number of the state and the country, we're still very high in terms of our new cases per day per 100,000 at 21. And just to remind you where those thresholds are from Harvard's Global Health Institute, community spread from 1 to 10 cases per day per 100,000 on rolling average, accelerated spread from 10 to 25. And that's really where you hit that tipping point where you begin to see exponential spread. And so this grouping of 21, 22, 24 new cases per day per 100,000 remains dangerously close to the tipping point. In terms of positivity rate, McLennan County has been relatively flat at 6%, and you see the state's positivity rate has climbed to 10%. And again, as a reminder, where those thresholds are of mitigation and suppression. Mitigation is at that 10%. If we can keep positivity levels less than 10%, we're able to slow the spread of the virus, and less than 3% positivity rate in order to suppress viral spread even further. Our effective reproduction rate in the state is 1.06, and in the county is 1.00. Again, an RT less than 1 indicates that one individual is unlikely to spread the disease to one additional person. So the goal is to keep the RT less than 1 in order to decrease the magnitude of spread across the community. I wanted to pivot now to emphasize something that's very important from a public health standpoint, and this is, I think, very important information in order to slow the spread of the novel coronavirus. And this pertains specifically to that population who is in quarantine. So this is an individual who's had close contact and is now in a period of quarantine, understanding that individual may be an asymptomatic carrier. They may be in that incubation period. They may be able to spread the virus and not know it, and so thus they're in quarantine. So this is specifically addressing that population who've had close contact with a known positive and are now in quarantine. So this is from the CDC. And I bring this up because I think that there's a lack of understanding in the community around this particular bit of information. So for emphasis, for those in quarantine, if your test is negative and you don't have symptoms, you should continue to stay home and self-quarantine away from others for 14 days after your last exposure to COVID-19 and follow all recommendations from the health department. This is important because symptoms can appear up to 14 days after you've been exposed and are infected. So this is, again, language taken directly from the CDC. A negative result before the end of your quarantine period does not rule out possible infection. And because a negative result during your quarantine can't rule out the fact that you're infectious, the CDC says, do not break quarantine early. A negative test does not mean you can stop your quarantine before the full 14 days. And I think that there's some lack of clarity. Folks are thinking, well, I got a negative test, so can't I go out now and not finish my full 14 days of quarantine? And that's just not the case. A negative test does not mean you can end quarantine early. So that includes football players and other athletes whose coaches want the win. You know, come on, if I just get him tested and he's negative, then we can put him back in the game, right? And the answer is no. Full 14 days quarantine. Employees whose supervisors are eager to get staff back to work. At the Family Health Center, we have almost 600 employees, and when one of them is in quarantine, you know, there's a sense of urgency. Oh, I just wish they could come back to work before that full 14 days. We just can't do that as employers. We have to keep our staff in quarantine for the full 14 days, even if the test is negative. Students in school, the same. And of course, young adults who want to get out and connect again with their friends. Negative test does not mean you can break quarantine before 14 days. So to really make this simple, I wanted to just kind of depict it here graphically for you. So bear with me while I walk everybody through this just one last time. So two individuals who are in close contact. These two people happen to be at work, could be on an athletic team, could be school, any scenario where there's less than 6 feet of distance, a cumulative 15 minutes within a 24-hour period. And then this individual tests positive for COVID. So it could even be up to 2 days before this individual tests positive for COVID. If there's close contact, then the individual who had close contact, well, they need to be in quarantine for a full 14 days. So what happens when that individual tests negative? Let's say they're 3 days or 5 days or 7 days into their quarantine and they test negative. Can they then return to work? Can they return to school? Can they suit up and get on the field? And the answer, of course, again, is no, absolutely not. It's really important that we all understand this. Finally, again, this graphic was lifted directly from the CDC webpage on quarantine. And I wanted you to see this calendar. If it doesn't come across clearly on your screen, go to the CDC website and search for quarantine, and you'll find this. And what I wanted to show you is that the last close contact in this example here on the first day of this sort of theoretical month. So the 14 days does not start on the day of close contact. The 14 days starts the subsequent day, and then there are 14 days before the last day of quarantine. So again, if you need any kind of clarification on that, look at the CDC website. particularly if you're someone who's an employer or someone who is advising someone else on when they can return to work or to play or to school. Make sure that you've referenced the CDC so that you understand what 14 days actually means. 14 days is 14 days. Okay, that's all I have. Thanks.
Thank you. That was great information. All right, let's hear from Dr. Brian Becker, Chief Medical Officer for Ascension Providence. Dr. Becker.
Thank you, Larry, and thank you, Mayor Deaver, for inviting me back as well. I hope everyone had a safe and enjoyable Halloween, doing things that were socially distanced and wearing masks, but enjoyed the holiday nonetheless. I appreciate Dr. Gregg's explanation on quarantine. I think there is a great deal of confusion in our community about that. And it's very important that we do our best to prevent the spread of the virus. In the tables that you saw, or the graphs that you saw from Dr. Gregg's, it's been pretty flat, and that's indeed what we see at the hospital as well. So our hospitalization rate has been pretty steady for months now. Over the last week, we've seen a bit of an uptick. We're back in the low 30s for hospitalized COVID patients at Ascension Providence. And again, I can really speak only to what I see in our organization. So I know in conversations that I have with my counterparts at Baylor Scott and White Hillcrest, it's very similar for them as well. But I am really speaking to our organization. In that population, it still remains about a third that will be in our ICU and 2/3 that will be in a standard hospital bed. We seem to have had some increase in the number of patients requiring ventilatory support using a ventilator. So that's been a bit worrisome for us over the past week. In this month, which we are now only a few days into the month, our positivity rate for patients that we are testing has been a little bit above 10%. So that's a bump for us from what was 6%, 7%. Granted, we're only a few days into the month, and that's awfully limited data, but that seems to be a higher number than we've been experiencing in the past month or two for sure. So that's a bit worrisome to me. We do test people who are screening positive in our emergency room, and we're testing everyone who is coming in for a procedure. Those are all getting pre-procedural testing just as a rule of thumb. So that's that population of patients. I'd like to say that we have plenty of beds, we have plenty of staff, so we've been short of those things in the past. As we begin to see flu season picking up, some of those hospital beds will be occupied by people with flu, as they are every year. So that does begin to put a bit more of a strain on both of our hospital systems as we try to manage through what's normally a busy season, and then throw on top of that our COVID patients as well. So at the present time, we're fine, both beds, nursing, and with our personal protective equipment that is so difficult to come by sometime. There's not been any significant change in the management of COVID in the last several weeks, months even, really. It's pretty much the same as it's been. So no silver bullet yet. I think vaccinations that we keep having conversations about and looking into are coming. I don't know that anyone has an exact idea of what that date may be. It may be in December, it may be at the beginning of the year, but there are a number of folks working on a vaccination that would prove to be effective for us. So everyone's getting ready for that rollout at some point, and we hope to be able to provide that to the folks in our community when we get those vaccines. I want to remind everybody to get their flu vaccine again. I think it's critically important this year that as many people are vaccinated against the flu as possible. So important to get that. And Dr. Eliason, who's not here today, tends to mention the mental health component. I think it's important to respect that as well. So we're moving into a season where mental health issues tend to become more pronounced. And we couple that with the fatigue and the worry that we see with COVID, and that's going to be compounded So in light of mental health issues, if you feel like there are issues, please reach out to your physician. Please reach out to the resources that we have in our community, and feel free to utilize those to help you improve that condition. Look forward to questions. Thank you, Larry.
Thank you, Dr. Becker. Waco Mayor Kyle Deaver. Mayor Deaver.
Sorry about that. Thank you, Larry, and appreciate everybody joining us today. I want to talk about COVID in just a minute, but first I want to congratulate our new mayor, Dylan Meek, on a great election win last night. And also want to congratulate Josh Borderoot and Kelly Palmer, the new city council representatives for districts 3 and 4. I want to thank all the candidates who ran for mayor and city council positions. Your interest in serving your city is appreciated, and we want to get you involved in some way. And I also want to thank Darius Ewing for serving as the council's appointed representative for District 4 for the last 6 months. Darius has done an excellent job, and Darius, we really appreciate your service. Dylan will be an excellent mayor. We are really fortunate to have him in that position, and we have a great city council elected for next year. There's a tremendous amount of experience there and 2 bright, talented new council members who will bring new ideas and new approaches to opportunities that present themselves for the city. So I really look forward to seeing the great things that they will accomplish in the coming months and years ahead. So now let's look at the latest data on our community's response to the coronavirus pandemic. Esmeralda, if you could put up the first slide. Thank you. We topped 10,500 cumulative cases yesterday in McLennan County, and cases continue to rise, as Dr. Griggs pointed out, at an unacceptably high rate in our community. The next slide, please. We've been averaging about 60 to 65 new cases per day for the last several weeks, but as of yesterday, the 7-day average hit 73. So we are starting to see that creep up, and we need to not see that creep up. We need to see it declining. If we continue to have that many new cases per day, we are going to continue to see far too many Central Texas hospitalized, far too many Central Texans on ventilators, and too many Central Texans die from this disease. I want to be clear that we're not trying to stop the disease. We can't. But what we can do is slow the spread until a safe and effective vaccine is available or there are more effective treatments for COVID-19. If we can slow the spread until that time, we will avoid many preventable serious complications and deaths from COVID-19. Next slide, please. Baylor continues to do a very good job containing the virus within their student body, faculty, and staff. They are averaging well under 10 cases per day and have been now for the last several weeks. Next slide, please. Dr. Becker mentioned that our hospitalizations have moved back up this week. This time last week, we had 42 patients in our hospitals being treated for COVID-19, and 8 of those were on ventilators. As of yesterday, we had 55 hospitalized patients, and 18 of those were on ventilators. And then, as Dr. Griggs said, as of today, that number was 60 patients with 15 on ventilators. Let's move to the next slide, please. We lost 6 more McLennan County residents to COVID-19 this past week. That was down from 11 from the week before. In all, we've now lost 160 of our friends and neighbors to this pandemic. And with our current number of cases and hospitalizations, I'm afraid we are likely to lose many more. That's the end of my slides. I want to thank all of you who have taken advantage of the free COVID-19 testing that's being offered all around our community. This is one significant way that we can impact COVID-19 in our community. This week, testing is being offered at Sacred Heart Catholic Church and Antioch Church, in addition to the drive-through testing in the parking lot at Heritage Square, which is at 4th and Washington across from the Convention Center downtown. I want to remind everyone that this is now exclusively saliva testing. There are no nasal swabs, and it is free. No symptoms are required. Just encourage everyone who has any concern at all, and even if you're just curious, get a test. It will help us identify those who are asymptomatic and may be spreading the disease. And, you know, this is really all about taking care of your friends, your neighbors, your family, and your community. If you go and get a test and find that you're positive, you can self-isolate then and prevent yourself from maybe causing serious serious illness and or death among those people that you love and care about. So just go to covidwaco.com and click on free COVID-19 testing. You can see the schedule and you can register for an appointment. And there's nothing that says that if you had a test 2 or 3 weeks ago, you shouldn't have another one. There's no limit on these, and we are encouraging people to really get out there and take advantage of this. So thank you for that, Larry, and I will turn it over to you for questions.
Okay, thank you. We only have a few questions today, and then we'll open it up to the 2 media people we have waiting. First question I have is, how many surge tests have been administered? How many results has the health district gotten back? And how many were positive?
Thank you, Larry. I do have those numbers. As of yesterday, we had 12,701 tests that had been administered. 10,486 of those had gotten the results back to the health district. And I think, they're typically getting those results back to the individuals even quicker than they're getting them to the health district. Of those 10,486, 536 were positive. And importantly, 199 of those 536 did not have symptoms when they were tested. So that's what we're looking for, is we're trying to find these people that do not have symptoms that would otherwise be spreading the disease in our community.
Okay, October was the deadliest month related to COVID. Will November follow that example?
Dr. Becker, would you mind giving us an opinion on that?
Yeah, it's an opinion, Mayor. We talked a little bit last week about October and the number of deaths that we saw across the 2 hospital systems here in Waco, and it was disappointing for sure. I think it's supposition to try to predict what we may see in November. So I am concerned that we're going to see an increased number of cases as we move into the month. Excuse me, just based on the trends that we have at present. So I am hopeful that we do not see a month like we had in October. I'm hopeful that it's not worse than October, but I'm concerned that might truly be the case at the end of the day.
Well, let's talk about spreading a little bit. Where does the virus seem to be spreading within McLennan County? Is it within families, workplace, schools, or where?
Dr. Griggs, what can you tell us about that?
Sure. For several weeks, we've seen our highest numbers in the young adult age group, 20 to 29 years old, and then spread fairly evenly in age brackets among those 30 to 60 and teenagers. The lowest incidents are in those less than 10 years old and in the age brackets older than 60 years old. Most immediately, we've been seeing the highest spread among families. So inside the household or outside the household, we're seeing spread there. And it's not surprising. I mean, just from a psychological standpoint, those who are familiar to us, who we love and care about, feel safe. We kind of instinctually think these are people who we can embrace, who we can be close to. But this is one of the cruel things about this virus. There's a paradox there, and that is that it's also those who we care most about who we risk threatening if we are one of those asymptomatic spreaders. So we have to be, I think, really on guard against our own instinctual desire to assume that someone who is a family member or who is relationally close is safe, or that we're safe to them. And in particular, those outside the household who are family members, we just have to stay 6 feet distance and wear masks and not make those individuals close contacts. Another area where there's been a little uptick in activity that I know the health district is concerned about and that we're watching very closely is in athletic teams. As you can imagine, these are frequently teenagers who already operate from a little bit of a sense of invulnerability. And when they're on a team and there's that camaraderie that goes with athletic teams, there's a risk of just lots of close contact. Also just intrinsically in the nature a lot of athletic activities, there's lots of close contact. And so this is an area of risk, and we're starting to see a little uptick in spread there. So just as a sort of a word of caution.
Okay. What is the average time a person will spend on a ventilator?
Dr. Becker, what are you all seeing? If you could answer that for your system.
You bet. So I think a decent understanding of what the course of the disease looks like has been evolving since February, March, and even before that from overseas. And what started out as a mortality rate that looked to be higher than 50% in significantly ill individuals has now dropped to 25-30% in patients on ventilators, at least. The hospitalization has decreased as well for those who are ill. The demographics of those who are hospitalized hasn't changed a great deal, but there has been some increase in younger patients who have been hospitalized. It seems like, as best I can discern from the literature, a little more than 5% of patients will get critically ill, and about 1 out of 4 of those would require a ventilator. And as I mentioned, the mortality rate in that population is around 25% or so. And I really like to work in concrete numbers and facts, but boy, they're few and far between as we try to navigate through this. And there's new literature that comes out every day that shifts these numbers a bit. So it's hard to nail down specifically. To the question at hand, what's the average time on a ventilator? I don't know that I have a number. I tried to find an answer to that and really couldn't find an answer. So I'll tell you anecdotally what we see. Our patients who progress from needing a little bit of oxygen to a lot of oxygen in a cannula kind of a situation, and ultimately to a ventilator, those patients oftentimes end up on a ventilator for a rather extended period of time. In talking to our intensivist, a patient with an illness not COVID related that ends up on a ventilator, oftentimes will begin to show improvement pretty quickly and come off that ventilator in pretty short order. It seems to be much longer for our COVID patients. So it's a very slow process for those who do get better. It's minimal changes day to day, and they oftentimes will end up on a ventilator for 2 to 3 weeks or longer. It has not been uncommon for us to have a COVID patient on a ventilator for a month or more. And so when we look at what's the average I would tell you is probably in that 2 week to 3 week range is probably an average that I could best say for you from our experience here at Ascension Providence.
All right. That actually completes all the questions we received this time. So we're going to turn to those on from the media that are registered. We have Brooke Crum from the Waco Tribune Herald and Robin Geske from KWTX News 10. So Brooke, we're going to start with you. Are you on the line, and what's your first question?
Yeah. Good afternoon. Earlier today we got word that Carver Middle School closed. They've had 6 people test positive, but a lot of teachers are quarantining. So I think it kind of goes back to what Dr. Griggs was saying about the need to quarantine. The district is urging students and families and staff to get tested, but is there anything else you would advise, them to do in this time?
Dr. Griggs, would you mind speaking to that, please?
Yeah, thank you, Brooke, for the question. I think one of the temptations for someone who's who thinks that they might have, maybe mild symptoms, is that they can get tested, and while they are waiting for their test result, they can just sort of operate as usual. And I would strongly caution our community against that. That even if you have a little tickle in the back of your throat, even if you're feeling a little worn down, and you get tested, to to function as if that test is positive until you get results back. In other words, if you think that you might have symptoms of even mild COVID-19 and you get tested, well, don't be active in the community. Stay at home, stay in isolation until you get those test results back. Other advice is if you are a positive, if you get a positive result back, it is so important that that you respond to your phone call. Even if you don't recognize the number, answer all of those phone calls to the unrecognizable number, because the health district or the vendors that the health district might use once they reach a threshold in terms of their capacity for contact tracing may not be identifiable in terms of the phone number that shows up on your caller ID. So if you've had a positive test, it's so important that you answer that phone call, because they're trying to do their public health work and properly address investigation and contact tracing so that they can protect the rest of the community. But they can only do that if the individuals that they reach out to answer their phone. And if they leave a voicemail because they missed you, to call right back that number and make connection. If you've had a positive and no one's reached out to you, go ahead and call the health district if no one's reached out to you in a reasonable amount of time.
Okay, Brooke, we'll come back to you in a moment. Let's go to Robin Geske with KWGX News 10. Robin?
Yes, sir. Our question is about, you mentioned, Mayor Deaver, that Dylan Meek, won the election last night. Do you foresee any changes in the city and the response to COVID as the kind of administration changes hands on the 17th?
Thank you, Robin. That's a really good question. I've spoken with Dylan at some length about what we've been doing. He has assured me that he wants to continue doing these press conferences, and we'll try to keep those going after next week. I would not be surprised if there were some change in approach, but I don't think you will see a significant change. Certainly not immediately. But that you really need to ask Dylan that question. But based on my conversations with him, I know that he knows how important it is to continue to try to do our best to protect our community while also trying to protect our economy.
Okay, Robin, we'll come back to you again. Brooke, do you have another question?
I do not.
Okay.
Sorry.
All right, Robin, you're up again. Have you got another question for us?
I guess I could ask, do you guys have any information or any idea of how long that surge testing will be available? I know that new sites are kind of popping up, here and there, within weeks, as the weeks go by. Do you know how long you guys will be able to kind of provide that to us?
Well, the current contract lasts till the end of the year, so through the end of December. And as we mentioned, and may not have talked about on this press conference, the health district has acquired this vehicle for mobile testing that is called the Aardvark. It will be going to various facilities around the community. And we've had tremendous success over the last few days testing at Antioch and at Sacred Heart Catholic Church. So we're going to continue to do those kinds of events. We are going to be losing the personnel that we've had from the Texas Department of Military as of November 15th. And so that's going to cause us to have to shift a little bit in terms of our manpower. That has been a really great service that they have provided to our community, to have the Texas Military Department here helping us with that testing. So that part of it will expire on November 15th, but we have ideas and plans for continuing that testing through the end of the year. And then beyond that, there will be additional testing, but it will just be something slightly different than what we have now.
Do you have another question for us, Robin? Since you're the only one, you're welcome to ask another or so.
No, thank you. I'm good. Thanks, y'all.
Well, thanks for thanks for stepping in. I know you're filling in for Drake, so anyway, so thanks for being part of it. Well, Mayor, that completes our time with the media that had registered, and that's all the questions I'd received. And I think you are the one that will probably wrap up this this press conference today. It's getting to be one of your last ones coming up here, and I know you're have mixed emotions about that, because I'm going to say right now the fact that you have done such a marvelous job in helping organize these and coming to our population with such passion and concern, and I can see your eyes tearing up, and I'm not doing it. Whenever you mention the deaths, it's a sad situation when we know what our families and our friends and our community is facing with this. And so a lot of people don't take this as serious as necessary, and I know you've done a great job of trying to convey that. You want to wrap us up with information before we leave?
Yeah, thank you, Larry. I appreciate that, and I really appreciate Brooke and Robin. Appreciate the press coming every week and asking good questions and helping us to get the word out to our citizens about what's happening in our response to COVID-19 and what they can do to help make our situation better in our community. I want to again thank Dr. Jackson Griggs and Dr. Brian Becker for being here. You guys do an amazing job. Jackson, thank you for that really well laid out explanation of the need to continue to quarantine for 14 days. I have repeatedly heard that being misunderstood, and that was a big subject when Baylor had to cancel its first football game. Everybody was unhappy that the players couldn't just get a negative test and go on and play. And that's just not the way the science works. And it's not our idea, it's the CDC's idea. It's the CDC's interpretation of the science, and it's their best guidance. And it's not easy. It's disruptive to have to quarantine, but the other option is far worse. And so we just have to recognize that and continue to get through this. It will not be, it's not going to go on forever. It's going to go on for a few more months at least. And we just got to do our best to try to keep this thing under control and keep anybody that can avoid it from catching it. So thank you all again for your participation and your input on this. And I want to thank again, Larry, you and your team, and Esmeralda and the city secretary's team, as well as the health district, Kelly Crane and your team, for all the great work you're doing. And especially want to continue to thank every week our healthcare workers and our first responders who put their lives at risk every day to keep all of us in the community well. And I want to thank all of those who've made the free testing in our community possible. This has been a tremendous collaboration between our Emergency Operations Center, the Health District, city and county personnel, as well as our state partners at the Texas Department of Emergency Management, the Texas Military Department, as well as the federal government, including the U.S. Army and Dr. Deborah Burks. This is a huge opportunity for our community, and we must continue to take advantage of it. I really appreciate all of you that have gone to get tested so far. As was said earlier, be sure to get your flu shot. We don't need to have that compounded on top of COVID-19 where we can avoid it. I do want to announce that next week we will not be having a press conference on Wednesday because it is Veterans Day. And we want to honor our veterans. It is a new city holiday. We have over 100 veterans that are currently working at the city. And so we certainly want them to have their time off, and we will not therefore have a press conference on Wednesday. We will have it on Thursday at 10 a.m. Until then, continue to please take care of yourself and take care of one another. We are getting through this together. Thank you.
Thank you, Mayor. And I want to remind everybody that today at 4:30, we will have a full replay of this and for our Spanish-speaking community. And also at 7 o'clock tonight, we'll play it on our channel again, Waco City Cable Channel. For anybody that's at work right now, or maybe you tell somebody what you've heard something and they want to hear it, you can watch it at 7 o'clock. And it's always available on demand, as we call it, from our website, which is wccc.tv. So you can check that out too. The mayor just mentioned the flu shots, always critical to get, and the Veterans Day. We want to hope that you will take advantage of the opportunity to recognize any veteran that you see, especially on Veterans Day. If you see somebody wearing a cap or something, tell them how much you appreciate their service, because they have sacrificed and have members of their family that way too. So we're going to be back next Thursday, not Wednesday, at 10 a.m., same place. We'll be having our same press conference weekly. And we're hoping to possibly have incoming Mayor Dylan Meek with us, join us. We're going to try to get him in here and get him indoctrinated, ready to take over for soon to retire Kyle Deaver, Mayor of that, and special time for that. So until then, we hope you have a great day.